As we transition into this new era where the community is trying to open back up, Ivinson is also considering how we open back our business. Hi, my name is Doug Faus. I'm the CEO of Ivinson Memorial Hospital. We'd like to first start off by thanking our employees for all the extreme hard work you've been doing in the last 2 months. It's been a long road for us, and we've got a long road to go. But your dedication has been extremely important to keeping the vigil of what this COVID could bring us. I would also like to thank our physicians and nurse practitioners and physician assistants for all that you're doing during this time. I know our businesses have changed and it's a little bit uncertain at this time, but it's important to have you as a partner and to care for our patients. And I also like to thank our community. The outpouring of support to Ivinson, to our employees. We've got businesses bringing us food. We've had volunteers making us masks. We've had many outpouring of well wishes. So I just wanted to take a moment and thank you as well. As we transition into this new era where the community is trying to open back up, Ivinson is also considering how we open back our business. As in the last 2 months, we've really constricted our business. We've really purposely chose to try to do as little as possible, except for those that have emergency type conditions. But as we move forward, we're actually starting today, Monday, May 4th, we've opened up our business about half of the way. We're spacing out our patients, so appointments are staggered. But we know there are people who are needing to come in and see us. Even though it's not an emergency condition, it might be for other things, other health conditions. So as of today, we've started to open up our clinic. We've opened up our laboratory. We've opened up our imaging department, and we will likely open our operating room here in the next week or two. I always want to correct people when they say elective procedures for an operating room. People make it sound like these are things that are like all cosmetic surgery, but these are procedures that people really need. Their hip replacements, their knee replacements. It might be colonoscopy, or it might be some type of gallbladder surgery. So these we might label them as elective, but in the end, they really are needed surgery. So we do need to get that operating room back up to help serve those patients that are in need. Yeah, as we go forward and open up our business, the one thing I'm always proud of at Ivinson is how clean this place is. We get continuous compliments on how clean it is. And as we move forward, it'll stay that way. We've implemented a few more procedures in our cleaning side of things. And this isn't just our environmental services team, it's also our techs that support procedures or support clinic exams. So cleaning in between patients, cleaning waiting rooms. I think in the last 2 months, we've seen our volume drop a lot. And I think that maybe there's a little bit of a misnomer that the hospital is a place you don't want to come because it might be dirty. But as we bring patients that have potential COVID symptoms into the hospital, whether it's the ER or the clinic, we're always isolating them into specific rooms and keeping that isolated to that area. And then being our buildings are newer, we've been able to put improvements into them. Our air handling systems are doing an amazing job of isolating the air into those rooms, into a negative pressure room. So that's helping keep our patients and our employees safe. So I just want you to be assured, you can come to Ivinson, you will be safe, and our cleaning processes are second to none. I think the other area that is still a work in progress is the testing. There's been a lot of discussion about two types of tests. There's the test that tells you whether you currently have COVID, and then there's this antibody testing that's starting to hit the market at this point. Some of those tests are a little unproven. We're working with our partner UC Health to try to find an antibody test that we truly trust and that we can roll out and actually get supplies for. So that's the next wave of very important work to get people back to their own jobs, but to bring other large companies and universities, school systems. We're going to need that testing in place most certainly by August when those kids come back to school. So that's the next wave of push for us, is to work with those partners to beef up that testing. So as we think about the next months ahead, I think it's important to stay attuned to not only things that Ivinson is putting out, but probably what you're seeing in the newspaper and other sources as well. But we want to open up our society to make it safe, but we have to get back to some sense of normalcy at some point. And I remain hopeful that that'll happen. But I do want us to take extreme caution as we go forward. I think one of the messages I deliver, at least in my family, is you got to do the things that your parents taught you, which is washing your hands. It's having good hygiene. And that should have always been a priority. So I think as we go forward, we're going to have to get back to those basics like our parents taught us, and keep moving forward and find a way to make us safe as we move forward.